Ladera Urgent Care and Integrative Urgent Care are led by Dr. Eric Brown, a seasoned emergency physician turned healthcare entrepreneur.
My name is Eric Brown. I'm an emergency medicine physician and I own two urgent cares. One is called Integrative Urgent Care and the second one is Ladera Urgent Care.
My name is Mary Beth Quesada. I'm the practice administrator for Ladera Urgent Care in Integrative Urgent Care.
After initially launching with Experity's predecessor, Dr. Brown tried switching to an internal billing model and a new EMR. The results? A significant drop in revenue.
Right around 2020, I said, well, let me try doing this myself because I felt more experienced with running the practice. So we switched to doing internal billing. And we also eventually switched the EMR to a system called Practice Fusion. And we started doing our own internal billing. But about 8 months into that, I realized that my revenue had decreased almost 30%. It was like a huge decrease in revenue.
That shift led them back to Experity, this time adopting the full suite, including EMR, PM, RCM, and BI tools.
I've been in the healthcare industry for 30 years and I've used many practice management systems and EHRs, and Experity is by far the best one in the industry. Is focused on urgent care. The CEO is a physician and focused on urgent care, so it just really fits. And the workflows and the BI tool, the data that we're able to get from it is all specific around urgent care.
With two busy clinics, training and onboarding needed to be seamless, and Experity delivered.
I think what helped is with Experity, they had a pretty robust system of training. So they trained the MAs, they trained the front desk staff, and then they trained the providers, and they all trained them separately. So their training process was a lot more robust than I had dealt with in the past with the other EMRs. And so by the time we got to the point of transitioning and seeing patients, they were ready.
Knowledge base is the best. You can get documents, videos. The system is just very user-friendly. It was kind of designed to follow the workflow, so it just makes sense and the onboarding process is very quick.
With Experity Revenue Cycle Management, the practices saw a marked improvement in collections and time savings.
Once we switched and once we started seeing the revenue and could actually work with our client success manager to kind of go over the data, to kind of go over the payers, to even go over credentialing. Like they would go over credentialing to say, oh, this particular provider is not credentialed, we need to work on their credentialing because it's holding back payments. So all those fine details that might have been missed when we were doing in-house billing, they were taken care of by the client success manager.
It is a leap of faith, right? Because you want to control it in financial, it's going to make you or break you in a practice. But Experity has been by far the right partner, and it is a partnership. Our account manager is phenomenal. I feel like I have an assistant there that I can reach with any questions. It gives me the freedom to be able to focus and audit and focus on growth opportunities for the practice versus just day in and day out of billing. So I absolutely love it.
Experity's BI tool became central to Dr. Brown's ability to manage operations, revenue, and staffing with data.
I use the BI tool to track not only operational information, but financial information, and I'll use that to kind of see how we're doing, if we're hitting the marks as far as everything, patient satisfaction, revenue, throughput times. It's all there, so I can kind of track it. And I didn't have access to that specific data with the other services. In regards to operational data, I look at throughput times and make sure that if certain providers are on, we're meeting the mark and not having patients wait too long. You can also get information related to coding data and CPT coding to make sure that the coding is accurate and represents the patients. So those are the big things I look at.
The BI tool offers a lot of data that I can see rejection and denials by reason. So if it's based because of eligibility or the incorrect information was entered, I'm able to then have that opportunity to train my staff and see if there's any confusion, with uploading or any kind of mishaps that the system is having. So it gives me an opportunity to be able to train and fix those areas.
The ROI extended beyond finances, giving the team more time to focus on care and operations.
Having somebody take care of the billing and the RCM management, I think it definitely gives me more time to work with staff and improve patient flow, patient encounters. Gives me more time to deal with that patients that may have had complaints, and you can take the time to kind of iron out all those details. So the more time I have to kind of address other things, whether it be staffing, whether it be patient encounters, it just frees up that much more time. And I think that makes the patient experience better when there's dedicated time to their care.
We use the e-register and Clockwise, and our patients are very happy. And it definitely makes, in the urgent care setting, it's busy, fast-paced, and customer service is very big for us to make sure that our patients feel cared for. And having all that automation in place, it alleviates the stress from our staff, and they're able to deliver that customer service that we seek for.
With my specific history of going through 3 EMRs in a pretty short time frame, I definitely would choose Experity again. It makes me think of like what would have happened if I had chosen them earlier, and how smoothly things could have been if I had chosen them earlier. So I would definitely recommend.
I would honestly say that it is on the top 10 because it is specifically for urgent care. Everything makes sense for urgent care with Experity. The company is focused on innovative AI, anything that where healthcare is heading, and all mapped around urgent care, which is going to be perfect for our needs.
And I mean, the proof is in the pudding. When you see more money, like you can you can justify like this makes sense.
I would highly recommend Experity for their software, BI, all of the stuff that they have to offer, and for medical billing.
From smoother operations to stronger revenue, Ladera and Integrative Urgent Care found a trusted partner in Experity.